Hey guys, today we are going to talk about special populations. First, we're going to cover the elderly, geriatric, frail elderly. Mental health disorders are common in older adults, often undiagnosed or untreated. Depression affects approximately 1 to 5% of community dwelling older adults, but rates are much higher in institutional settings, reaching as high as 11%. Economic impacts to consider: mental health issues in older adults contribute to increased healthcare utilization, longer hospital stays, and higher rates of nursing home placements. Evidence-based tools to use. Geriatric Depression Scale is a great, widely used self-reporting tool, available in short and long forms. Approaches for assessment and diagnosis. Comprehensive geriatric assessment involves multidisciplinary evaluation of physical, mental, functional, and social statuses. DSM-5 consideration. I would definitely be aware of sadness and depression. Some pharmacological interventions include antidepressants and antipsychotics, which are often used for dementia or psychotic disorders. Collaborative care strategies. Integrate care models involve collaboration between primary care providers, mental health specialists, and other healthcare professionals. Psychotherapeutic options, cognitive behavioral therapy, interpersonal therapy, problem-solving therapy. Another population to consider is pregnant and lactating population. Mental health disorders, particularly depression and anxiety, are common during pregnancy and the postpartum period. Economic impact: untreated perinatal mental health disorders are associated with increased healthcare costs, both for mother and infant. Evidence-based tools, we like to use the PHQ-9 self-reporting measure for depression severity, and the GAD-7 for anxiety. Routine screenings are imperative, and some DSM-5 considerations would include the postpartum depression, major depressive disorder. Pharmacological interventions. Antidepressants, SSRIs, are often first-line treatment. Collaborative strategies often involve a multidisciplinary team involving obstetricians, psychiatrists, primary care providers, and pediatricians. Psychotherapeutic options include cognitive behavioral therapy, interpersonal therapy, and supportive psychotherapy. Another population we need to consider is pediatric and adolescent. Mental health disorders are common in children and adolescents, with approximately 1 in 5 a diagnosable mental disorder in a given year. Anxiety disorders are the most prevalent. Untreated mental health issues in youth lead to significant long-term economic costs, including increased healthcare expenditures, involvement with the juvenile justice system, social development, and future employment prospects. Evidence-based tools that we like to use: the Child Behavior Checklist, CBCL, is a parent report questionnaire for assessing behavioral and emotional problems. Approaches for assessment and diagnosis: observation, gathering information from parents, teachers, and the adolescents themselves, so self-reporting. DSM-5 considerations would include ADHD, conduct disorder, oppositional defiant disorder, and the most common, anxiety. Stimulants are the first-line treatment for ADHD, such as amphetamine, salts, and derivatives. Collaborative care strategies, school-based interventions, collaborating with the school to implement accommodations and supportive services. Psychotherapeutic options also include cognitive behavioral therapy, parent management training, and dialectal behavior therapy, and play therapy used in younger children. The LGBTQ community experience higher rates of mental health disorders compared to the general population. So pharmacological interventions, no specific difference in drug metabolism based on sexual orientation or gender identity. Affirmative healthcare providers for collaborative care strategies, connecting individuals with providers who are knowledgeable and affirm LGBTQ identities. And psychotherapeutic options includes cognitive behavioral therapy and dialectal behavior therapy, family therapy. Immigrant and migrant workers often face unique stressors that contribute to higher rates of mental health issues. Untreated mental health conditions can lead to reduced productivity, job instability, barriers to accessing mental health, lack of insurance, language barriers contribute to delayed treatment and poorer outcomes. Culturally adaptive screening tools, using validated screening tools, translated and culturally adapted for specific cultural groups, approaches for assessment and diagnosis. The DSM-5 tool is designed to gather information about the impact of culture and individuals' experience of illness. The DSM-5 emphasizes cultural formulation. Concepts of distress can influence in how symptoms are experienced. Pharmacological interventions include medications to treat underlying depression, anxiety, PTSD, collaborative care, community-based participatory approaches,